Hello, everyone. Welcome to the Environmental Research webinar. I am Song-Kyun Park, faculty member in Epidemiology and EHS. So this seminar series is sponsored by the Michigan Life Stage Environmental Exposures and Disease Center, M-LEEaD. So we have a very interesting topic for today. The Dr. Ashley Malin, who is an assistant professor in the Department of Epidemiology at the University of Florida. And she is a licensed clinical psychologist. She completed a postdoctoral fellowship at the Econ School of Medicine at Mount Sinai and Keck School of Medicine of USC. So she has been researching health effects of chronic low-level fluoride exposure for over a decade. She was awarded a K99R00 from NIEHS to examine impacts of early life fluoride exposure on child neurodevelopment and sleep behaviors. She recently published the first US-based prospective study on prenatal fluoride exposure and neural behavior, which I believe she will be introducing that study today. So please join me welcoming Dr. Malin.
Thank you. Thank you for inviting me, and I'm very excited to be here today speaking about fluoride. I'm just going to share my screen. So today I'll be talking about fluoride exposure, neurodevelopment, and some of the public health implications of the most recent research. I don't have any conflicts of interest to disclose related to this material. And for the presentation, I will talk a little bit about what fluoride is and what are some of the common sources of fluoride exposure that we typically encounter in the US, what fluoridation additives are, the effects of fluoride on the body, neurodevelopmental impacts of fluoride. I'll talk a little bit about the recent NTP report on fluoride exposure and developmental neurotoxicity and cognition that was published last month, or released last month, and some public policy considerations. Can everyone see my screen okay, or is this thing, hopefully nothing's obstructed. Let me know if it is. Fluoride is an environmentally ubiquitous mineral. It's the ionic form of the element fluorine, and it naturally occurs in rock and soil, but it can leach from rock and soil into drinking water, and so it can naturally occur in drinking water via this pathway. Community water fluoridation consists of the process of adding fluoride into the community drinking water for dental caries prevention. And this process began in 1945. Currently, approximately 72% of the US population on community water systems receives fluoridated water for dental caries prevention. And a concentration of 0.7 milligrams per liter is considered optimal. This concentration was lowered in 2015. It used to be a range of 0.7 to 1.2 milligrams per liter, but this recommended level was lowered because dental fluorosis was so highly prevalent among youth in the US, and that was one of the reasons for recommending lowering the concentration. So now 0.7 is considered optimal for both preventing dental caries, but also preventing risk of adverse systemic health effects, particularly dental fluorosis. And dental fluorosis is an outward manifestation of excess fluoride exposure. So it can result in white spots on the teeth, as you can see here in the case of mild fluorosis, but also brown spots as fluorosis becomes more severe. Unfortunately, the latest data from NHANES, so from the 2015 to 2016 cycle, showed that 70% of US children and adolescents had some form of dental fluorosis. So half of this cycle was assessed after the recommendation was lowered, but it would be interesting to see what the prevalence is in the last 8 years as well. So there are various sources of fluoride exposure. Fluoridated water tends to account for approximately 60% of fluoride intake among adults in the US and 40% of intake among children in the US, according to an EPA report. These percentages are higher when we consider all of the foods and beverages that are reconstituted with the fluoridated tap water. So really any food that is processed or made with fluoridated water is then going to contain fluoride. Other sources of fluoride exposure include tea. So green and black tea has been shown to contain potentially high concentrations of fluoride. Also pesticides or foods sprayed with fluoride-containing pesticides, certain pharmaceuticals, and of course dental products like toothpaste, mouthwash, and fluoride treatments at the dentist. Now, in terms of what's added to the drinking water for community fluoridation, the NSF approves and certifies 3 fluoridation additives. So these include fluorosilicic acid, sodium fluorosilicate, and sodium fluoride. These are synthetic chemicals. They're different than the naturally occurring fluoride that we see in the environment in that sense, and they are byproducts of phosphate fertilizer production. And I would liken these more to chemical mixtures that also contain fluoride. Research has shown that these chemicals can contain other metal co-exposures, including arsenic, lead, and aluminum. There was a study conducted examining metal concentrations in hydrofluorosilicic acid and sodium fluoride, observed these metal co-exposures. Sodium fluoride also containing barium and quite high levels of aluminum. Both chemicals contain quite high levels of aluminum as well. And research also shows that fluoridation chemicals, when combined with disinfecting agents, including chlorine or chloramine, can leach lead from lead-bearing plumbing into the community drinking water. So it can also contribute to co-exposure to lead via this mechanism. In terms of how fluoride is metabolized in the body, it readily accumulates in bones, teeth, and other calcium-containing organs and glands. It can also be released from bone back into the blood during bone remodeling, which is a lifelong process. And in terms of fluoride's effects on the teeth or other parts of the body that contain hydroxyapatite, fluoride replaces the hydroxyl ions in hydroxyapatite to form either fluorohydroxyapatite or fluorapatite, depending on how much of the hydroxyl ions are substituted. And you can see this process through this illustration here. Where the fluoride replaces the hydroxyl ions. Of course, this is a beneficial mechanism for dental caries prevention because fluorapatite is a more crystallized structure, and it's also less soluble in acidic media, so it helps to prevent and create a resistance to dental caries in part by that mechanism. However, as I mentioned, teeth aren't the only part of the body that contain hydroxyapatite, and from ingestion of fluoride, fluoride can have quite complex effects on bone. So it can increase the crystallinity of bone, thereby increasing bone mineral density. But because fluorapatite matures slower than hydroxyapatite, it can also contribute to changes in bone quality and bone weakness. So fluoride can decrease the surface area of bone and interfere with bone mineralization. So therefore, it can contribute to bone weakness in the midst of increasing bone density, and also increased risk of fracture we've seen in several studies. The pineal gland is a small gland located at the base of the brain between the two hemispheres outside of the blood-brain barrier. It produces melatonin, which is, of course, important for sleep regulation. And research shows that fluoride can highly accumulate in the pineal gland hydroxyapatite. and can contribute to pineal gland calcification. Pineal gland calcification has also been associated with disturbances in sleep and also neurological problems, including pediatric primary brain tumor, increased risk of Alzheimer's disease, and multiple sclerosis. Okay. Neurotoxic effects of fluoride have been, sorry, it wasn't multiple sclerosis, schizophrenia was the other one. The neurotoxic effects of fluoride have also been well demonstrated in the animal literature now for decades, particularly in the adult animal literature, but recent studies have also shown that low-level fluoride exposure can readily cross the placenta and accumulate in the developing brain and brain regions implicated in learning, memory, mood, attention, and executive function. Fluoride has been shown to alter cholinergic activity, increase oxidative stress, and alter glutamate metabolism, among other things. And one of the reasons I became interested in this topic was after reading a study by Malin and colleagues at the Forsyth Dental Institute that was published in 1995, showing that rats that were exposed to sodium fluoride early in development developed ADHD-like symptoms. So from prenatal exposure, it was associated with symptoms of hyperactivity, particularly in the male rats, and then postnatal exposure was associated with symptoms of inattention and hypoactivity, with a more impact on the female rats. And so the interest in research on fluoride exposure and neurotoxicity, developmental neurotoxicity in human studies among researchers in North America has really emerged in the last decade or so. In 2012, Philippe Grandjean and his team at Harvard School of Public Health, they conducted a systematic review and meta-analysis on this topic. At this time, there were no North American studies conducted, and so this review consisted mostly of studies from China and then a few from Iran. And the authors concluded that the results support the possibility of an adverse effect of high fluoride exposure on children's neurodevelopment. So the fluoride exposure in the studies included in this meta-analysis were generally quite higher than what we would encounter in the US. And at this time, it was really considered pretty controversial to even raise the question that fluoride at levels relevant to the US population could potentially be developmentally neurotoxic. So to even really start to look into this question was considered quite controversial at this time. It's really interesting how much difference a decade can make. And so in 2015, I decided to conduct the first human study examining the association between fluoridation prevalence and attention deficit hyperactivity disorder prevalence in the US. And the findings showed that states in the US with higher community fluoridation prevalence also tended to have higher ADHD prevalence after adjusting for socioeconomic status. And so this was an ecological study using CDC data, really hypothesis generating. We couldn't, of course, form any solid conclusions based on this study. But 2 years later, there was a rigorously conducted prospective study in the Element cohort based in Mexico City, led by Howard Hu and his team. And they examined associations of prenatal fluoride exposure with IQ among children between the ages of 6 to 12. They found that each 0.5 milligram per liter increase in maternal urinary fluoride during pregnancy was associated with approximately 2.5 point IQ reduction in the children between the ages of 6 to 12. So this was really a landmark paper that was the first prospective study to rigorously examine this question at exposure levels that are relevant to the US population. So we now know from subsequent studies that the levels that were observed in the element cohort are quite comparable to those observed in pregnant women in the US as well. And then following that study, many more studies on prenatal fluoride exposure and neurodevelopment across multiple domains have been published. So there was one study published the same year in neurotoxicology, but those levels of fluoride exposure were higher than what we would typically encounter in the US, Canada, and Mexico. But they did observe higher prenatal fluoride exposure was associated with poorer cognitive development on the Bailey scale. And then in the element cohort, another study was published that found that higher prenatal fluoride exposure was associated with more symptoms of ADHD, particularly in the realm of inattention. Then there was a widely publicized paper published in JAMA Pediatrics that examined fluoride exposure during the prenatal period in relation to IQ among children in Canada. They found that each 1 milligram per liter increase in maternal urinary fluoride across pregnancy was associated with a nearly 5-point IQ reduction in the boys. Here's another study. Another study published in Mexico City that found that higher dietary fluoride intake during pregnancy was associated with poorer neurodevelopment in toddlers. And then a more recent study looking at community fluoridation in a Canadian cohort that found that higher exposure to water fluoride was associated with poor inhibitory control and measures, I believe, of cognitive flexibility. So this was an executive function study. And then there was additional studies published in both the element and MADRES cohort examining domain-specific effects and timing of fluoride exposure during the prenatal period in relation to health outcomes at different ages. And so in terms of the research on this topic that has been conducted in North America, the findings have generally been consistent in that higher prenatal fluoride exposure has been associated with poorer neurodevelopmental outcomes across various domains. There have been some inconsistencies in the international literature that have not observed these associations. And so as Sung-Kyun mentioned, I led a study that was recently published in May, the first US-based study to examine impacts of prenatal fluoride exposure on child neurobehavior. And so I'm going to talk a little bit more about that paper now. So this study was conducted in the MADRES cohort, which consists predominantly of Hispanic women who are of low income status, living in urban Los Angeles, California. And our study included 229 mother-child pairs who had urine fluoride measures during trimester 3 of pregnancy, and also had children who they rated on the child behavior checklist at age 3. And we also had data from of urinary fluoride during trimester 1 in a subsample. And urinary fluoride was measured in spot samples at the Oral Health Research Institute, Indiana University. As I mentioned, during the first and third trimester, using the gold standard diffusion method and adjusted for specific gravity. Unique to our study is that most of the women were able to comply with fasting prior to urine collection. So approximately 84% of the sample, 192 women reported fasting. The child behavior checklist is a parent-reported measure of child neurobehavior. It was completed by the mothers in this study when the children were approximately age 3 and consists of 99 items rated from 0 to 2 based on the preceding 2 months. It includes 7 syndrome scales. You can see them listed here. And these syndrome scales are then comprise different composites. So one is internalizing, the other is externalizing. Emotionally reactive, anxious, depressed, somatic complaints, and withdrawn comprise the internalizing composite. And then attention problems, aggression problems, or aggressive behavior rather, comprise the externalizing composite. And then all of the 99 items are summed to create the total problems composite. There's also 5 DSM-oriented scales: attention deficit hyperactivity problems, depressive problems, anxiety problems, oppositional defiant problems, and autism spectrum problems. And these scales are comprised of items determined to be consistent with DSM-5 diagnostic categories. For the internalizing, externalizing, and total problems composites, T-scores ranging from 60 to 63 are in the borderline clinical range, and then scores above 63 are considered to be in the clinical range. And so we calculated a 2-category clinical index variable of normal compared to borderline clinical or clinical for statistical analyses for each of the composite variables. And then we used raw scores for syndrome and DSM-oriented scales as recommended by the scale developers. We conducted covariate adjusted linear regression of associations of specific gravity adjusted maternal urinary fluoride with CBCL index T-scores and the syndrome and DSM oriented scale raw scores. And then we conducted covariate adjusted logistic regression of associations of MUF-SG with the binary clinical index variable scores that I just described. We adjusted for covariates including maternal age, pre-pregnancy BMI, ethnicity by nativity, education, prenatal household income, marital status, and child sex. And we also tested for sex-specific interactions. There were an even number of male and female children in our study sample. Approximately 14% had a total problems T-score in either the borderline clinical or clinical range. And the median MUF-SG was 0.76 milligrams per liter. The IQR was 0.68 milligrams per liter. So these levels are, again, quite comparable to those observed in other cohorts based in Mexico and in Canada. So they're comparable nearly exactly to those levels observed among pregnant women in fluoridated communities in Canada. We found that an IQR increase in MUF-SG was associated with nearly double the odds of children having a total problems T-score in the borderline clinical or clinical range compared with the normal range. A 2.29 point increase in internalizing problems T-scores, and a 2.14 point increase in total problems T-scores. We also observed associations of higher maternal urinary fluoride during pregnancy and higher scores on the emotionally reactive syndrome scale, the somatic complaints syndrome scale, and the DSM anxiety problem scale, as well as DSM autism spectrum problem scale. So while we observed an association with total neurobehavioral problems, we see that these are mainly in the realm of internalizing symptoms. We also conducted various sensitivity analyses, including restricting the sample only to participants who reported fasting, examining associations of first trimester urinary fluoride with scores on the CBCL, averaging first and third trimester maternal urinary fluoride and examining associations with child CBCL scores, and also adjusting for blood lead. And the findings remain consistent across these sensitivity analyses. And so this study generated a lot of interest from the public and the media. It was featured in various mainstream media outlets, as you can see here, and sparked I think, a lot of discussion around whether the levels of fluoride in the drinking water in the US are safe for pregnant women to consume and for the brain of their developing babies. Then a few months later, so late last month, the National Toxicology Program published their monograph on fluoride exposure, neurodevelopment, and cognition. This is a comprehensive systematic review that has been highly anticipated. It's been years in the making. It has been reviewed and revised so many times, and it was finally published and also generated considerable media attention, both from national and international media. And so this report constitutes the first time that a government program affiliated with various government agencies has made a determination about the association between fluoride exposure and child IQ. And so if you read it, it's over 300 pages. It's quite comprehensive and rigorously conducted. The report focused mainly on human studies, but also included some animal and in vitro studies, mainly to provide insight about potential mechanisms. There were 72 studies on fluoride and IQ in total, and the vast majority of those did observe associations, inverse associations between early life fluoride exposure and lower child IQ. The authors of the NTP report also assessed each study for potential risk of bias by dissecting the methodology of each of them. And they determined that 19 studies were at low risk of bias. And so those studies form the basis for their conclusions on fluoride exposure and potential developmental neurotoxicity. So the report states that 18 of these studies reported an inverse association between estimated fluoride exposure and lower IQ, although this finding pertains to studies that had drinking water fluoride exposures that exceeded the World Health Organization guidelines for drinking water quality of 1.5 milligrams per liter of fluoride, so double the recommended level that pertains to the US and also to Canada. So Canada also has the same recommended level, and Mexico, fluoride is added to salt in regions where water fluoride is below 0.7 milligrams per liter. So it's kind of a universally recommended standard. And so these studies pertain to approximately double that. The report concludes there is moderate confidence in the body of evidence that estimated fluoride exposure is inversely associated with IQ in children. And the report clarifies that the moderate confidence in the inverse association, so that conclusion is relevant to some children living in the US, including at a minimum those living in areas where fluoride in drinking water is known to be at or above 1.5 milligrams per liter. So it definitely includes those children exposed to the higher levels. But when it comes to lower levels, the report said that they're not sure. Oops. And so in terms of the children who are exposed to the high levels of fluoride, the report states that nearly 2 million people are served with community water systems with levels at 1.5 milligrams per liter of naturally occurring fluoride or higher, and approximately 1 million are served by systems with greater than or equal to 2 milligrams per liter naturally occurring fluoride. So potentially millions of people affected by these higher levels. And in terms of the association between drinking water fluoride levels below 1.5 milligrams per liter in children's IQ, the authors of the report stated that this association remains unclear. So they didn't feel they had enough research that had been conducted on this topic to make a confident determination. It only included studies up to 2023. So my recent paper was not included in this. Not sure whether that would have made a difference or not. The report also states that it's plausible that pregnant women and children living in optimally fluoridated communities, so with the recommended level of 0.7 milligrams per liter, that they could have a total fluoride intake at or above the level of those living in a community with water fluoride levels of 1.5 milligrams per liter or higher. And the reason for this is because, as I mentioned, water is not the only source of fluoride exposure. So depending on how much fluoride exposure a pregnant woman, for example, is getting from other sources, is she drinking tea every day? So depending on that, her total fluoride intake could potentially exceed that of a woman who's living in a region with fluoride levels in the drinking water of 1.5 milligrams per liter or higher. The NTP report also highlighted various areas of research that remain undetermined, so areas where more research is needed. Whether higher fluoride exposure is consistently associated with lower IQ among children in regions with water fluoride at levels below the World Health Organization guideline has yet to be conclusive, according to the report, and so more research in this area is needed. The report also highlights that there's a lack of studies on fluoride's impact on adult neurocognitive outcomes. They only identified 2 studies that they consider to be well conducted, and these were cross-sectional studies. So more research on effects of adult neurocognitive outcomes in the US or at US relevant levels of exposure are needed. And of course, a US-based study on fluoride exposure and IQ has yet to be conducted. So there's also a need for that. In terms of public policy considerations, so this has been a topic of ongoing discussion, and particularly now with this NTP report being published. The question for policymakers to consider is what the margin of safety needs to be between the fluoride dose that's administered for dental caries prevention and that which is consistently associated with reduced IQ in children. So how much of a buffer does there need to be between those 2 levels? And also whether, from a bioethical perspective, can community fluoridation continue when neurodevelopmental impacts of fluoride levels below 1.5 milligrams per liter are considered to be inconclusive. So to say we just don't know if it's potentially causing brain damage at these lower levels. And also when potential impacts on adult neurocognitive function are really uninvestigated. So I think these questions are being addressed there's a trial going on now against the EPA to end community fluoridation. I'm told there's going to be a ruling in the near future, so we may have answers to these questions pretty soon. Want to acknowledge the collaborators and funders of the research I presented, and happy to take any questions. Thank you.
Great, this is very interesting. Okay, so for the audience, so if you have any questions, so you can use the Q&A. You can find the Q&A on the bottom, and so you enter your question, or you can directly just enter your question to the chat, and we will take care of this one. So while you are thinking and entering the question, so let me start some questions. So this is a like the point set, you mentioned that the 0.7 is the current the water fluoridation level like most of the US community use, or so 1 point. So can you clarify that? So 1.5 and the 0.7, and so what are the current level that the US drinking water system they add to the drinking water?
So the targeted level is 0.7 milligrams per liter. It can vary according to states. There's some flexibility in terms of what is added. And I'm thinking the data from NHANES show the concentrations generally on average lower in US community drinking water than 0.7. Whereas the NTP report, their conclusion about moderate confidence between early life fluoride exposure and reduced child IQ was for higher levels. So that was for levels exceeding 1.5 milligrams per liter in drinking water. So,
Okay.
yeah. I see in the chat.
You can also see directly, but so because for those who will be watching this in the future, so I will read anyway. So, but you can see the question. So, do you advise your pregnant friends and family to avoid fluoridated tap water?
Do I advise them?
Advise them to avoid fluoridated water, tap water.
Yes. That's my honest answer. Yeah, because I think there's so much that we still don't know, right? And fluoride is not an essential nutrient. The benefits have largely been demonstrated to be primarily topical. And so I think that if people are concerned, it's understandable. And they can focus more on using a fluoridated toothpaste and filtering their water. They could filter it, drink bottled water. There's different options with, I think, pros and cons of each option. So,
okay. So
yeah.
maybe the follow-up question. So then the water filtration system, like just the tap filter or the Brita filter, and does that filter out the fluoride from water?
Brita does not.
Does
as
not.
far as I know, yeah, because it's a carbon filter. And so to filter out the fluoride, we would need something like a reverse osmosis filter. There are tabletop pictures that state that they remove 90% of the fluoride as well. So we know that the reverse osmosis systems, they can be quite costly. So I think the tabletop pictures are a more affordable option, assuming they do what they say they do. And, but again, there's pros and cons to each option. The tabletop pitchers are usually made of plastic. So if people are concerned about exposure to microplastics, they don't want their water sitting in a plastic pitcher or plastic bottle. I think that's a fair concern as well. So.
Yeah, so we have now multiple questions from the Q&A. So you can also open the Q&A and then see the question, but I will read.
Okay.
Yeah, question from Dr. Alan Duquesne. So does this topic cross over to similar questions for PFAS, or is that a different question due to lower water concentrations?
Sorry, what was the question? If the result findings are generalizable to PFAS? Oh, here we go. I see them now. So I don't do PFAS research, but So I think there's people looking into whether the PFAS chemicals can increase fluoride exposure because of the fluorine. I'm not, is that the question or?
Yeah, I think so. The question is about like a fluoride versus fluorine and
Okay.
yeah, but yeah.
I think it's undetermined at this time, as far as I know.
All right, so another question from our own doctoral student, Jashin Wu. So thank you for this amazing presentation, Dr. Malin. I'm wondering, is there any current guidelines or instructions specifically for pregnant women regarding how to reduce their fluoride exposure or eliminate the potential adverse effect of fluoride exposure during pregnancy?
No, there isn't. And that was one of the conclusions from our recent paper, was that maybe there needs to be these guidelines and recommendations for pregnant women to reduce fluoride intake as a precaution, just given the consistency of the studies now showing an association at US relevant levels.
Okay, so another question from Professor Stuart Batterman. So Ann Arbor here, Ann Arbor's latest water quality report shows fluoride in the range of 0.53 to 1.0 milligram per liter. Interestingly, the EPA limit as a MCL is 4 milligram per liter. Worth noting that there are mandatory reports, so pretty easy to find out local levels.
Yes, thank you for that question. I think that's a good way. If people are wondering what fluoride concentration in their community drinking water is, like you said, you can access those reports quite easily. Sometimes they need to be requested, but they're public information. And yeah, the EPA limit, it's high. It's quite high. Of 4 milligrams per liter, even thinking in the context of the recent NTP report, these 1.5 milligram per liter levels were considered high levels. So what is 4 milligrams per liter going to do to someone? Or 3 milligrams per liter?
Okay, another question from the Q&A is, do you recommend only drinking filtered or bottled water and not drinking tap water?
So I think that if people are concerned about consuming fluoride in their tap water, then the way to circumvent that is to drink either filtered or bottled water. The issue of tap water, fluoride isn't the only potential contaminant in tap water. So I think if people have concerns about not only the fluoride, but whatever else is being excreted in there or added during the treatment process, there are ways to avoid that.
Yeah, so we have more questions from Q&A, but just maybe I think this is important because the fluoridation, there should be some benefit. It's not just this is just not good. So is there any study like comparing risk and benefit of water fluoridation beyond just neurodevelopment and then cognitive effect among children? So do we have any like a very comprehensive assessment, like a risk assessment of water fluoridation?
So I think the risk assessment, if I'm understanding, is being conducted as part of the ongoing trial. I think that that's the literature is kind of being assessed and reviewed in that sense. But other than that, I'm not aware of such a study or assessment. And there was a comprehensive systematic review on the efficacy of fluoridation for dental caries prevention that was published. It was a Cochrane review in 2014. And they found it was approximately that community fluoridation, first, that the studies were poorly conducted on this topic, but that the existing literature showed a gain of, I believe, saving one tooth from caries from community fluoridation. So some people say, okay, so we're comparing one tooth to potentially 5-point IQ reduction. The NTP report also showed it was approximately 2 to 5 IQ points reduced across the studies examined. So how do we decide who makes that determination? Is it a determination someone should be making on behalf of the public? So these are the questions that have been circulating.
And so the challenge is because most of the U.S. community have this fluoridated drinking water, so that's why it's very difficult to find a true control group compared to the exposure group, and also the looking at the variation of exposure, and that's why based on that population, and we can determine the true risk of drinking this fluoridated water versus benefit of the drinking water, like a fluoridated drinking water, and so we need to think about how to design such a study to conduct the validated risk assessment for water fluoridation.
Yes, I agree, and it's surprising that this research has only been conducted in the last decade. The studies on developmental neurotoxicity in humans.
So we have several other questions from the chat. So you can open the chat and then you can see other questions. So Meredith asks, so do you know in US what percentage of people drinking municipal water vs well water?
I'm not sure the percentage, but the latest numbers from the CDC show, I think it's approximately 63% of the country receives community fluoridated water. Something like that. So most people, but I don't know specifically for well water what that percentage is. And I don't think
like a natural contamination. So there should be some, could be very huge difference, but typically the natural contamination level is above 1.5.
Mm-hmm. Yeah.
And then in US, so what area may have higher like a natural contamination? Is it similar to like arsenic?
Yeah, I don't know. The EPA, they have this data. I don't know exactly geographically where these wells with high fluoride levels are, but it's true that the levels we see that are exceeding the MCL, these are generally in well water.
Okay.
And so, yeah.
So the next question is, why is the CDC recommended fluoride level still at 0.7 if there have been numerous studies showing that even moderate levels of fluoride in water is dangerous to children?
I think only they can answer that.
Yeah. And then this could be the last question from the audience is, how much assurance is there about bottled water not having fluoride?
Sorry, could you repeat that? I got distracted by a call.
How much assurance? So how can we make sure that bottled water does not contain fluoride?
Yeah, that's a great question. So we also can't verify that. In the US, the fluoride content of bottled water isn't labeled. In Canada, it is. So I've seen fluoride content on bottled water in Canada labeled. In the US, it isn't. So, and I don't know whether the levels in the same bottled water brands in the US and Canada are the same. So I think that could be an important policy change as well, to start labeling so that we do know. And not only bottled water, but the foods and beverages reconstituted with the tap water. And maybe tea also, because we just don't know.
So the last question just came out. So do you know what is the total fluoride intake from all sources is generally consumed? Example, food, beverages, medicines, absorbed from dental product, etc. What is the total fluoride intake?
Total fluoride intake, that will differ depending on the person. So I think that could be different for everybody. And I don't know that there's been a study, certainly not to my knowledge, a nationally representative study since, well, that there was this US EPA report in 2010 that examined total fluoride intake, but not since then that I'm aware of. So, and also I don't know the total when all sources are considered, but it could be quite high for some people.
Yeah, okay. All right, so it's time, so 12:52. So thank you for your excellent presentation and also answering a lot of questions from the audience. And so in 2 weeks, so we will have the researcher and resident webinar, and the environmental research seminar will come back on October 22nd. And the Professor Meredith Petty at the Department of Epidemiology will be speaking about her recent study. Again, thank you, our speaker today, Dr. Malin, and also thank you for the audience. So have a wonderful day. Thank you. Bye-bye.
Thank you, everyone.